I've considered.
Let me share them.
Thank you. As you do that, I'm very grateful for the organizers of this meeting. And first of all, let me explain what TVET is. TVET is a technical vocation and education training. And in my university, we have a board of directors, and I'm the chair of that board at Masini Muliro University of Science and Technology. My topic today is about multidisciplinary approach, focusing on One Health concept towards managing pandemics response in Kenya. And I want to appreciate the immediate past presenters who have acted like the building block of my presentation. And my presentation really is trying to take you through the journey that our country, Kenya, has gone through in matters of pandemics. Next slide, please. That is my name, thank you. I want to indulge you by starting by saying that our first lab safety by security policy guideline came out in 1998. And the information contained therein actually was as per the WHO guidelines, and also issues to do with occupational safety and health 2007 regulation, coupled together with the environmental management and coordination law, and then the National Infection Prevention and Quality Control Guidelines for Healthcare Services in Kenya. So they were intended to be used by individual labs across all levels. Next. So the rationale really is that medical lab personnel handle biological materials, and this happens worldwide for numerous genuine, justifiable, and legitimate purposes, where small, large volumes of live microorganisms are replicated, and where cellular components are extracted, and many other manipulations are undertaken for purposes of education, research, medicine, and health related to mass commercial and industrial production. Generally, that's the rationale behind why we are having these guidelines from that early. Next. But the public has expectations, because the people who work in the lab are the personnel who know what they manipulate and handle. So it's incumbent upon them to take responsibility so that the community is not exposed to any fire risk. So they follow working guidelines, and biosafety comes cardinal, which helps to keep the area we work safe. But when it comes to biosecurity, we follow a code of conduct to ensure that these pathogens that we handle are actually safeguarded and secure. So we don't allow lab personnel to acquire infections because or disease because they know what to do, and which can only happen if they breach the same safety and security, which can result in unsafe or insecure environment. Next slide. Now, around 2019, we had the One Health concept introduced, and this was meant to break professional silos. Health personnel have been working as silos, everybody concerned with their cadre or area of specialization, without bothering to know what the neighbor does. So it occurred then that in February 2019, we had this risk analysis training by One Health East and Central Africa, abbreviated as OSEA, which was hosted by University of Nairobi. And participants in this training included regulatory bodies that deal with medical lab, veterinary, wildlife, public health, and nursing. They came together and started piloting this issue of One Health concept that now encompasses everybody within the health sector and beyond, so long as they are relevant to health matters. Next slide. So this was an interesting agenda actually, and it was interesting to realize that it was being pushed by veterinary professionals who are now calling medical personnel, all the cadres to come and look at aspects of zoonotic diseases and how they affect human health. And it was very nice to realize then that some of the zoonotic diseases, once they happen or they occur, they actually become a medical problem in as much as veterinary importance. So the initial involvement involved the medical practitioners at this board and the pharmacy and poison board, who initially did not attend this meeting. But then people who attended that particular training asked the organizers to involve everybody, including the medical radiation board, because our country is considering going the nuclear power way, and there is a regulation board that deals with those matters. And then this brings in the aspect of nuclear safety. Next slide. So the resolutions of this meeting were that then all people must be involved. And then everybody must buy in the concept of One Health. And the modules that are being used in this training were to be customized to suit various regulatory needs. And then there was need to do an analysis and then see what is appropriate for continuous professional development or continuous medical education, if you like. This was to be done for those who are in pre-service training too, so that they're not left behind. So people and sectors were expected to then customize these modules to fit where they are based. Next slide. Other resolutions included the fact that the trainers seek accreditation from various regulators through formal application. Then there was need to consider onboarding all professionals on One Health concept. And then we gave ourselves a timeline that by 2020, this CPD, continuous professional development, will form part of renewal of practice licenses across board. And then we propose to have quarterly meetings and regular sharing of information. Next slide. Along the way, we had the Kenya National Laboratory Biosafety and Biosecurity Training Curriculum developed as the first edition in 2014. And this was then improved to encompass risk management. And the basis was still a One Health approach, but it was strategically designed to address gaps identified, including biosecurity, so as to generate a harmonized and integrated curriculum based on international best practices that would strengthen biorisk management system for all human, animal, and plant health sectors, as well as any other relevant sectors, because then we realize that we are not able to produce professionals who can assess a situation and determine the risk inherent in that situation. Next slide. So this first edition really was based on the Global Health Security Agenda initiative through WHO's joint external evaluation exercise for Kenya, which recommended the development of a joint and common curricula under the lens of One Health for biosecurity training and training of trainers for the agriculture, health, and health sectors as a priority action. And this was also meant to strengthen national collaboration and coordination efforts among the key stakeholders and players across all levels. Next slide. Come 2019 April, the second edition was processed, and this was co-owned by the government of Kenya under the auspices of the Principal Secretary, Minister of Health, and the Principal Secretary, State Department of Livestock, on behalf of all other relevant ministerial departments, namely agriculture, livestock, fisheries, and irrigation. Actually, this was a game changer in terms of how we handle issues around here. Next slide. So this improved curriculum cuts across 11 modules with a broad applicability to all sectors. And these are the main emphasis on the biological threat reduction, priority activity, particularly in the face of continuous disease outbreaks, emerging and emerging disease pathogens, and bioterrorism threats. At this point, we were not even aware of the COVID-19 pandemic. So we had started preparations without knowing what would happen. And really, when it really happened, then we found ourselves really able to have cascaded this training across all cadres. Next slide. So in this harmonized curriculum, we have got several levels of training. The There are those who technically handle pathogens. They have their own modules. There are those who manage that, those who do that work, and those who supervise the same. The curriculum is stratified to fit any of the levels. And then there's the top management actually that facilitates the execution of these through financial and administrative support. Then we have field workers. We now have trained colleagues to be able to go to the field if there's an epidemic and handle it and set up lab-like situations out there and contain whatever pathogen that might be there. And also for the support staff who handle the waste that emanates from this process. Next slide. So what extra efforts have we put in place? In the spirit of what we are doing today, it has come to a realization that it's important to involve all people, because no single cadre or sector can fight a pandemic, for example. So we are looking at everybody in every place where they are working and the activities that they do that would expose them potentially infectious biological material or other hazards. So we are making proper utilization of the curriculum by all of these sectors so that the personnel are protected from potential harmful pathogens, as well as secure infectious agents against accidental release or deliberate misuse to harm people, animals, plants, or the environment. Next slide. Looking forward, this multisectoral One Health laboratory biorisk management curriculum was developed as a result of the need to promote and share culture of responsibility, reduce dual-use risks, mitigate biological proliferation, and deliberate use threats, and ensure safe custody of biological agents. Across board, it is no longer an issue of the health sector alone. We are involving all sectors, as I'm going to demonstrate shortly. Next slide. So the situation analysis globally, we all know then that there's increase in biological risk resulting from these outbreaks, emerging and emerging diseases, pathogens, and potential bioterrorism threats have also made it very inevitable that we must then start approaching things holistically as opposed to operating in silos. Next slide. We all know then that although bioscience and research but technological advances are important in providing intervention strategies for emerging disease threats to humans, animals, and plants sectors, and also enhancing food security. These activities also are associated with biorisk because they can be misused. So essentially speaking, in as much as biological or bioscience advances are happening, they are still pose a big threat to the security and safety of everybody on this planet. Next slide. So in understanding the situation, we know then that this could be both accidental, naturally occurring, or even intentional, not only to the lab and field workers, but also the community and environment at large. We all know that before 9/11 happened, nobody knew that an aircraft was a deadly bomb. So people with ill intentions really can turn around what is meant to be good for everybody to be a very, very previous situation. Next slide. So we have different players and sectors within our country. So we have the country's agricultural, veterinary, medical personnel who work in labs as well as in the field. And because they are constantly exposed to infectious agents, we raise concerns regarding the need to ensure proper biosafety and biosecurity standard practices as implemented to protect workers and the whole community at large. Next slide. So tooling this personnel, they are given knowledge, skills, and abilities necessary for effective assessment and management of biorisk to be able to protect themselves, other workers, secure the biological materials that they handle, and also protect the environment generally. Next slide. So what is the country strategy? We are sensitizing and training all relevant personnel, and we use a sector-wide approach under One Health. We have reviewed the undergraduate curriculum at all levels to incorporate biosafety and biosecurity with the concept of biorisk management being at the forefront. And then we are also as a country considering starting a course in biosafety and biosecurity cadre, and this will form part of my presentation tomorrow. Next slide. So this year, again, we received a call that we need then to participate or establish a project known as International Risk-Based Agent Prioritization. And the methodology here is that as a country, we are looking at how to produce a list of country-specific high consequence agents and toxins. And these are materials that have the potential to pose a severe threat to public health and safety, animal, plant health, or animal or plant products. So this list that we are going to generate then is meant to support legislative efforts to regulate pathogens of security concern within our jurisdiction. Next slide. So this is a project under Africa Centers for Disease Control and Prevention, and the regulatory and certification framework for institutions handling HCATs is a priority area for them under the Biosecurity Initiative 5-year strategic plan that is running from 2021 up to 2025. And within this plan, then we have the sub-activities within this priority, which includes provision of technical assistance, member states to develop this list, and pathogen data sheets building on the existing country-specific zoonotic disease priority pathogen list. Next slide. We are a pilot country for this, and then it's through the CDC Africa's Eastern Africa Regional Collaborating Center, which is based in Nairobi, and we have a technical, the technical partner, which is Sunday Labs of USA, who are transferring this IRAP decision support methodology and requirements for success to the technical working group, which has been formed by the Kenyan ministries and government agencies and other looking at today. Next slide. So the purpose of the technical working group is to collaborate with relevant institutions to develop the said list of biological agents and toxins of security concern that can be utilized to determine the lists in support of the government's national biosafety and biosecurity system. Once we have the list developed, then we'll a framework to ensure that this is actually secured as intended. Next slide. So it involves all relevant ministries. We have the Ministry of Foreign Affairs, because from the previous presenter, you have seen that the entry of these pathogens at ports of entry, they follow a pattern. So Ministry of Foreign Affairs comes in very, very handy, together with the Ministry of Department of Immigration. Then we have the Ministry of Health. Then we have an institute known as Kenya Biovaccine Institute that is charged with the responsibility of developing vaccines following this pandemic. Then we have the Global Health Security. We have the heartbeat of lab services in the Republic, that is known as National Public Health Laboratory Services. And then our country is involved, so is health. So we are involving the Council of Governors through the health committee representatives. Next. So you can see also we have a newly gazetted National Public Health Institute, which is going to be known as a CDC Kenya. And then we have the regulator that deals with the medical lab matters, that is known as the Kenya Medical Laboratory Technician Technologies Board. We have our renowned Kenya Medical Research Institute, which has a membership representation. We have the Zoonotic Disease Unit. We have the Ministry of Agriculture, Livestock and Fisheries. Next. We also have Veterinary Epidemiology and Economics Unit, the Central Veterinary Laboratories, Regional Veterinary Investigation Laboratories, Kenya Veterinary Vaccines Production Institute, Kenya Agricultural and Livestock Research Organization, Kenya Plant Health Inspectorate Services. Next slide. We also have the Ministry of Defense is not being left behind. And in the Ministry of Defense, we also have the Directorate of Medical Services. We have the Ministry of Interior, which deals with security matters. And under it, we have the Government Chemist. We have the National Disaster Management Unit. We have the National Intelligence Service, National Police Service, the Office of the President. Next slide. The Ministry of Tourism and Wildlife, under which we have with the State Department for Wildlife. We have the Wildlife Research and Training Institute, and then the Kenya Wildlife Services, all under the Ministry of Tourism and Wildlife. Next slide. We also have the Ministry of Environment and Forestry, and then under it you have two authorities. We have the Kenya Forestry Research Institute and the National Environmental Management Authority. Then you have the Ministry of Education, and under it we have the State Department for University Education and Research, and then we have the National Commission for Science, Technology and Innovation, and then we have the Commission for University Education. Next slide. We also have a legislative authority that was established when GMO concerns were happening, and it's known as the National Biosafety Authority. And in Parliament, the last Parliament, we have a new Parliament now, we were looking at establishing the National Biosecurity Authority too. Then we have the Ministry of ICT, Innovation and Youth Affairs. We have the Institute of Primary Research. And then, of course, we are bringing everybody on board. National non-governmental institutions or organizations have not been left behind. We have the Biorisk Management Association of Kenya. We have the Africa Biosafety Authority. And then we also have the International Livestock Research Institute on board in this technical working group. Next slide. So what are our forward steps as a technical working group? We have agreed that processes must move. So 50+1 is the quorum of the committee. And then we are drawing our terms of reference. We are defining the leadership and their roles. And then we are looking forward to coming up with the requisite list of these pathogens and toxins. And then we'll continue the sensitization and training of all cadres and sectors as we develop or as we move forward with this project. Next slide. So we also have existing structures within our system that help coordinate all these matters. We have the Division of Global Health and Security, which is domiciled within the Ministry of Health. And then you have the Biosafety and Biosecurity Unit under it. And then, of course, in the Ministry of Labor, we have Occupational Safety and Health Authority. And also we are working closely with the World Animal Health Organization, a regional office that is based in Nairobi. Next slide. So, in view of emerging diseases and in view of the fact that we must carry everybody on board, because safety and security is everybody's concern, because it might not be your daily activity, but when it happens, then it hits you. So we are looking at reskilling and upskilling secrets, which involves learning new skills, where upskilling refers to specializing in core skill. We have skill transformation, which requires assessing current skill gaps, global industry sector trends, developing an efficient strategy, and scaling the strategy for seamless execution across the country, region, and globe. Because pathogens know no boundaries, so they'll not care whether it's happening in Uganda, Tanzania, or Kenya. We can go anywhere. And then why do we need this skill transformation? We know that retain is one of the most crucial investments that an individual or country can make as part of talent management strategies, and it's so justifiable. Next slide. So I want to thank you for your attention by saying that this is an exciting time to be in safety and security, and if challenge, innovation, change, and personal growth are of your interests, then please stick around. Thank you very much for your attention.
Thank you very much, Mr. James, for that wonderful session. Are there any questions?
Thank you very much, Dr. James Sakwa. I am honored to be your colleague in the Examination and Certification Committee at Africa CDC. I would like to thank you so much for this presentations, and you are talking, you are describing in more details about the activity in Kenya. Indeed, I have many questions, I think more than 3-1. So I would like to summarize. Firstly, of all, what is the relation between the One Health in East and Central Africa organization and the multi-sectorial One Health laboratory biorisk management curriculums. This is the first one. The second one regarding you are talking about the training, you are dividing the training into 3 levels. My question is, what levels do you mean? Do you mean the training at the beginning, intermediate, and advanced level? Or do you mean, because you have wide varieties of sectors, do you mean you have training for each sectors aligned to the level of these sectors? This is the second question. Maybe you can first answer these 2 questions and then I will continue my next question. Thank you.
Thank you, Doctor. Thank you, Doctor, and colleague at the Certification Examination Committee of Africa CDC AU. The first question is about the connection between the One Health concept in East and Central Africa. In one of the slides, I did present that the concept was being advanced by the veterinary colleagues in the University of Nairobi, and they were working across the region, East and Central Africa. Those are the first colleagues who started this process, and they use one common curriculum across the region for One Health concept in terms of risk analysis. So it's one. Secondly, when it comes to the training, it is stratified because of all the ministries, department, and government agencies I've mentioned. Each of them has people in positions of management. Each of them has technical people who might be handling pathogens, and all of them have support staff. So this curricula is stratified according to those levels, because the manager, the person in top management, needs to understand why, for example, they need to buy more gloves. Unless they understand that, it becomes a difficult thing. They might prioritize buying fuel as opposed to gloves when there's need. So the curriculum is such that it accommodates and takes care of every person, regardless of where they are and the level they're operating from. I hope I've answered you, Doctor.
Yes, okay. The next question regarding the course of the Biosafety and Biosecurity. I know that you are working to conduct undergraduate course and professional career curriculum for the Biosafety and Biosecurity. I would like you to give us a brief about this, because it is very important and unique, not only in the region but even in the continent. And we are indeed in Egypt, and also we hope in North Africa make something like that. So later we can talk in details, but briefly, could you give us a general idea about how you can conduct this graduation or this curriculum for Biosafety and Biosecurity?
Thank you, Doctor. I would like to say that, as earlier shared, I have a comprehensive presentation tomorrow about it. But a snap view of this is that when we got the One Health biorisk management curricula, we customized our pre-service or undergraduate curricula to take that course. The challenge we found is that it has 13 modules, and within the semester we could only do 6, which goes to the transcript. So innovatively, we decided then the other 7 we will do in the subsequent semesters using free time. And at the end of the training, we would certify the students as a way of having a ripple effect of spreading the relevant training to our graduates. The upshot of this is that it then attracted the attention of the regional, the East African IFBA regional representative, who then introduced us to IFBA itself, and then we were lucky. The IFBA executive board was desirous of having this course done as a professional cadre in view of the COVID-19 pandemic, because all of a sudden then we had pathogens all over the world, all over the place, and there was nobody who is specifically trained to handle them in a safe manner. So when they placed a request to us, we were most obliged, and the findings of the surveys we have done are part of the results I'll be giving tomorrow. So hold your horses.
Yes, great. My next question regarding the methodology, because to develop, you are using to develop the your own HCAT list, because you know that this is a very critical issue to for the prevention, control, and response for the pathogen. We have to first know what is a very important pathogen in our country. Then we have to go to the other program. So please, could you briefly describe what is the methodology you are using to develop your own HCAT list?
We all know that each sector has notifiable diseases from a public health point of view. And I'll give a classical example of anthrax. Anthrax is zoonotic, is for cattle. But once it occurs, it's a health problem. So it takes the vets and the livestock officers to say, this is anthrax. Then as it now, by involving all sectors, as I've enumerated, we are getting to know what are the priority and notifiable diseases in all the sectors, and we are compiling all that list. Once we have it at the technical working group, we will review and agree how to prioritize them, and then reach a consensus.
Yes, but it seems that you are also concerned with the toxins, yes? Not only for the...
oh, yes.
So you have also an expert...
Oh, yes. These pathogens, some of them produce toxins.
Yeah.
So we are cognizant of that, and we are taking note of that.
Yes. My last question, and I'm sorry for these long discussions, regarding your...
No, it's okay, sir.
Regarding your technical working group, you are talking about these vast, wide varieties of sectors, indeed. I think all the sectors in the country. And this is very good, because to prevent or to respond for the pathogen, you have to involve more stakeholders. I think you think many challenges regarding how you can involve and engage these sectors, especially for the sectors a little bit away from the life science. For example, DOD or the Department of Defense or Department of Transportation, etc. So, because indeed we are keen to make something like that in North Africa, to make technical working group at the level of each country, and the technical working group should be involved as much as sectors as we can. So could you give us a brief about this challenge and how you overcome this, especially for the training issue? Because if you are training even for example, for the veterinarians, if we are talking about the lab veterinarians, the training will differ than when we are talking with the field veterinarians. How can you imagine when you are talking about another very different sectors? So could you please give us briefly about how you can overcome this type of challenge? Thank you.
Thank you very much. The first challenge you get when you have a large group, because you're involved in is quorum for a meeting. So after much argument, we agreed then we need 50 plus 1. So they could be 100. If you get 101, we meet. That is the first challenge. Otherwise, you don't move. Number 2 is the issue to deal with roles and responsibilities. Who is going to be the secretariat? Who is going to be the head of the committee? Those are challenges that you have to be prepared for. But now coming back to the training, the One Health curriculum for biorisk management is a generic one. Okay, so depending on the audience you are addressing, they are supposed, the curricula or the presenter or the trainer is supposed to customize to fit. And let me give you a classical example. When the pandemic occurred, truck drivers who move across countries became the immediate threat. But after sensitization, they got to learn that they have to be tested. In every place they go and present a valid test result. So it becomes something that people absorb if you involve them and sensitize them appropriately. Then coming back to another challenge, the fact that some of the people, they don't see a pathogen as seriously a problem. And we see a lot of cases of people who are told that this animal has anthrax, and they still go ahead and steal some beef and meat, and they fall sick. So the other challenge you have is for people to understand and appreciate that these pathogens and their toxins, where relevant, are dangerous. So this can only be done if everybody is on board and is sending out the same message at different levels with different understandings, while not forgetting the cardinal role. You'll remember then that when you travel to a country that has yellow fever, for example, when you land in the airport, the first person you meet is the public health officer. It's not the immigration form if you have no relevant papers. So if we involve everybody and sensitize the community, it is going to be easy to drive this message across board. Thank you.
Thank you very much, Dr. Ali, for those questions. We have a hand online from Dr. Fatinasid. You can unmute. And since it's the first time you're speaking to us, you can quickly introduce yourself first, then you ask your question.
Thank you,
James.
Hello everyone. Nice to see you online. I'm from Tunis. I'm a doctor, engineer in bio-risk management, and I work in National Institute of Sanitary and Environmental Health, which is under the Ministry of Health. I work essentially in bio-risk management and biorisk assessment. So nice to see you all online. I arrived a little late, and I would like to know, where is the biorisk assessment in your institution in the biorisk management chain? Because we cannot talk about management without talking about assessment. Voilà.
That is the question to you, Mr. Jeff.
Exactly, Iman. And the curriculum has a module that deals with risk assessment. And in one of the presentations, one of the slides, I said that initially we had people who were trained by safety, by security, without necessarily understanding how to assess risky situations. So out of the 13 modules, we have a module that is specific for and complete with the practicals on how to do risk assessment. Thank you.
I see. Thank you.
Yes.
Thank
you very much, Dr. Fatnas, for that question. You have another question physically here, yes?
Okay. I have a question that is related to the question that Ali gave. What I want to ask is the bio-risk curriculum you develop in Kenya. You said that you develop a training curriculum based on the target audience. And on the other hand, Africa CD, it have a certification program. So my question is, for example, for top management training you develop, are they going to be certified for biosafety? And is this included in the Africa CDC certification program? That's my question.
Thank you very much. The training for biosafety, biosecurity at that level is open to people who do that work that involves biosafety and biosecurity. It doesn't matter the level, so long as they practice it and they have experience in it. And once they are trained, they are certified as such. And what Africa CDC is doing is then that we are now having the training of trainers. The first training just happened in Ghana last week. And these are the ones who are now supposed to come and cascade this training within specific countries. So if you are managing biosafety, biosecurity as a manager, and that's what you do and it's demonstrable, they are allowed to train for this, and they are going to certify. Thank you.
We have one more question here.
Excuse me, if something missing, I have missed something. I would like to know if your curriculum, if the corresponding level, for example, if it is one of IFBA certification of the corresponding is level master degree or license degree? This is the first question. The second question, I can go ahead. The second question is the collaboration of One Health. Sometimes we have a good collaboration in the top level, the ministry level. In Kenya, do you have a good collaboration in the village level? For example, if we have an outbreak in the village, do you have the collaboration of veterinary or medical sanitary? Thank you.
Okay, the network was not very nice, but let me try to respond in as much as there was disconnection here and there. Now, the first question is about certification at different levels. Yes, using the Kenyan curricula, we still certify at whatever level. When it comes to the course you are going to do, there'll still be certification. And then all these things run in parallel, including the certifications by IFPA and the exams that are given by IFPA. So we are not restricting anybody. But within Africa CDC, I know there are discussions about those certifications and how they can be acknowledged as somebody pursues this career. Now, the issue of collaboration with government, yes, the government is the backdrop of everything. Even in as much as we have in our country health that is devolved, we all report to the national government Ministry of Health and with its state agencies that give direction. And as a country now, we have the Director General of Health who issues directives on what is supposed to happen using the Public Health Act. So yes, even if it's a small disease outbreak and it's notifiable, the county reports to the national government. So that system exists.
I'd just like to follow up on that second question. What the question was is that as you're achieving the One Health approach in top management, do you have similar efforts at the local levels to have One Health approach at, let's say, a village level or a sub-county level? Do you have that in Kenya?
We are still using the county governments. We are still using the county governments that are now expected to cascade it to the lower levels, because once a guideline or curriculum is issued by the national government, it is given to the relevant county ministers of health, who are supposed now to look at their ministers at that level, and then they cascade the directors to what we call sub-counties and ultimately health centers. The lowest unit for us is health center. That is the one that is found in the community. So it is a process that runs from top to the bottom.
Yes, does that answer your question? All right, any other question before we... All right, so what we are going to do next is thank you very much, Mr. James, for the wonderful facilitation.